Following outcome 1 and 2 for unit VCS02. Aims and objectives. This PowerPoint and associated handout activities will cover the following. Describe the common sites and routes of administration of medications in animals. List the common forms of presentation of veterinary medications. Identify the correct types of medication and dosage terms used for the administration of common veterinary drugs. State the importance of accurate record keeping and of informing the veterinary surgeon or RVN of any problems that arise following administration of a veterinary medication. And state the procedure to follow if a problem arises following administration of veterinary medication. Some of these aspects are a little bit of a review from previous weeks. However, this is useful in order to test your knowledge and understanding, and such activities can then be looked at by your veterinary educationist to assist in that. Continued. Point 6. List the legal requirements of the dispensing of veterinary medications. Point 7. List the potential hazards with the main groups of drug types. And please note, aspects of this session will feature revision aspects as they have been covered in the previous lesson, so it is to assess your knowledge and understanding from previous sessions. Aspect 1. Describe the common sites and routes of administration of medications in animals. You had an adjoining handout related to the previous PowerPoint, and I would like for you to review your knowledge of the subject matter by creating a mind map to review your routes and the commonly used sites for administration of medication. Have a go at stating the advantages and disadvantages relating to the routes and sites, and ensure as a bare minimum that you cover those used for cats, dogs and rabbits. If you want to expand on your knowledge further, you can also discuss in relation to guinea pigs and rodents. List the common forms of presentation of veterinary medications. Again, within the previous session, you completed and researched within your handout common forms of presentation. Produce within the adjoining handout a list of common forms. Consider forms of medications relevant to topical, oral and parenteral administration. Again, do this in a way that you can review your knowledge of what was covered in the previous lesson, to assess whether you need to cover any aspects further and to check that the knowledge is there. When we're talking about forms or presentation, consider the different formats for those routes listed. Point 3. Identify the correct types of medication and dosage terms used for the administration of common veterinary drugs. As you'll be involved in relation to selecting medicinal products in your practice on behalf and under direction of qualified staff, it's really important you can identify correct medications and also understand the relevant dosage terms that relate to frequency of medication. Within the adjoining handout, complete the task relating to identification of correct drugs and dosage terms. Point 4. State the importance of accurate record keeping and of informing the veterinary surgeon or qualified veterinary nurse of any problems that arise following administration of a veterinary medication. This task is to be completed in your adjoining handout to outline your understanding of the above statement. I would like you to consider when doing so the fact that the veterinary surgeon is ultimately responsible for having administered the medication, even if the task has been delegated to a qualified member of the team or to yourself. Consider the importance of why we report such issues to the qualified members of the team and what that may bring about and why we need to do so quickly and accurately. Consider the means of record keeping that take place and also reporting of such an issue. In follow-up to point 5 asks you to state the procedure to follow if a problem arises following the administration of a veterinary medicine. Again, there is a task to complete with the adjoining handout in relation to the statement above, and I want you to think about what the procedure should be. It would also be really useful to talk to your mentor about what route you would follow, and also what sorts of problems may arise as well, to review your knowledge in relation to the previous session. Again, in review of what has been covered in previous sessions, for point 6, I would like you to list the legal requirements of the dispensing of veterinary medications. I would like you to, for each of the legislations listed below, provide a few key points to show your understanding of the legislation and where it comes into play when it comes to dispensing of veterinary medications. Then, using your textbooks or e-resources, I would like for you to describe the main dispensing categories and their differences. So please produce a table listing POMV, POMVPS, NFA-VPS and AVM-GSL. Give yourself an explanation of what those terms mean and who it relates to in order for prescribing and dispensing. And then you could also give yourself some examples from your own workplace to reiterate what categories they come into. And again, please see related tasks within the adjoining handout. Point 7. List the potential hazards with the main groups of drug types. Potential hazards that could occur when dealing with medications in practice are spillage or breakage. This would be something such as that contamination of surfaces, clothing, hands and patients. And also yourself, so consider the type of product you are administering and the control methods to provide to protect you and others. For example, use of gloves for products containing steroids. We must take care to ensure that when we are dealing with medications, that we ensure the aseptic technique when drawing up injectables and also administering of them, to ensure that we ourselves don't contaminate the medicinal product and cause potential harm for our animal. And we must be very cautious of inadvertent or accidental administration. So, for example, injecting ourselves, nicking ourselves with a used needle following injection having been given, products being squirted into eyes, etc., if not using the correct gauge of needle. So anything such as this occurring should be recorded in the accident book, and we can consult the compendium or data sheet for guidance with our qualified team, and also contact the doctors for advice to see if they advise anything further. So in summary, for VCS 02, Learning Outcome 1 and 2 are now completed in full, with coverage of both PowerPoints and also adjoining handouts for completion.